Virtual humans, similar to the one seen here, provide students an opportunity to view unique injuries, practice healthcare provider to patient communication, and provide feedback based on the interactions so that students can iteratively improve their performance. This work was inspired by toward virtual stress inoculation training of pre-hospital healthcare personnel, a stress-inducing environment design and investigation of an emotional connection factor, in which they looked into how virtual humans and storytelling could be used to induce stress. This previous work led to two research questions. Can virtual patients in augmented reality be used to induce stress in healthcare professionals? And can stress management techniques be learned and applied in augmented reality to help reduce stress levels for some healthcare professionals? Nurse practitioner students and nursing faculty at the University of Central Florida used this simulation of an ER after a mass casualty incident. In this simulation, there is a virtual victim on a bed in front of you. Participants had to triage the patients one at a time in an accurate and timely manner. After each patient was tagged, the participant would write down their stress level. The next patient then appeared on the bed. This type of interaction provides nursing students the opportunity to practice skills they have learned in a safe but realistic environment. The flow of the study went as follows. The participants began with informed consent, then watched a background video providing information on the situation, number of patients, and the types of injuries they were to see. They then saw a tutorial patient and to understand how the simulation worked. After this, they began the simulation by triaging the first 3 patients. Then there was a break when they were taught a stress management technique. And the participants then finished the simulation with the final patients while they were applying the stress management technique. Then the participants continued to debriefing with the UCF faculty, where they also answered surveys. Our simulation followed the guidelines for START triage, which includes 4 categories to triage patients as. When triaging patients during this simulation, participants could talk to the victims about their injuries, check their breathing, remove patient clothing for examination, walk around the patient to locate injuries, check the radial pulse of the patient, apply a triage tag based off of START triage, and then participants could move on to the next patient. At the end of the study, each student was debriefed by the UCF nursing professors. They explained what was wrong with each patient and the signs to be looking for. To measure stress levels, we looked at the stress levels of all participants as well as the stress level of each virtual patient. The stress level means were the same for both of these categories, but the standard deviations differed. We were able to see that the standard deviation did differ among participants, but there was not a large standard deviation between the different virtual patients. We also looked at stress management technique results. We found that the stress management technique did not seem to work for some, while it did work for others, it seemed. We cannot conclusively say this, but we were able to see that the mean for those that it worked with saw a reduction in the stress levels of about 0.73, and for those who did not see an improvement in their stress levels from the stress management technique, saw an increase in their stress levels of about 1.22. So, to return to our previous research questions, can virtual patients in augmented reality be used to induce stress in healthcare professionals? We found that there was some stress that seemed to be induced, but we cannot conclusively say this, but we believe that our results warrant further investigation. As for can stress management techniques be learned and applied in augmented reality to help reduce stress levels for some healthcare professionals? While we did see that some healthcare professionals saw decreases, there were others that saw increases. So we believe that maybe there's a possibility that the stress management technique did work for some, while it did not work for others, but we believe this question also warrants further investigation. There were some limitations with the study. No baseline was taken for stress beforehand, so we cannot say whether these participants came in with already increased levels of stress. Also, the patient order was not randomized, which may have led to an ordering effect, and we also know that more participants are needed in order to have more conclusive findings. Our work has led us to two future research questions that we believe need to be investigated further. These include, what different features of virtual patients can be used to increase or decrease stress in healthcare professionals, as well as what stress management techniques can be implemented in augmented reality simulations to help participants find techniques that may be more effective for coping with their own stress.